Hello and welcome to the Symposium on Healthcare Value Analysis and Infection Prevention. I'm Kelly Pyrek, editor and publisher of Healthcare Hygiene magazine. I invite you to explore with us the key issues that these two disciplines can address in a challenging healthcare landscape. We've gathered thought leaders from across the country to share their expertise with you, and we hope you'll find the sessions to be a springboard for further dialogue at your institution. No important undertaking like this symposium is conducted alone. We appreciate our incredible speakers for their hard work in preparing their presentations. We also thank our partners in this endeavor, the Association for Healthcare Value Analysis Professionals, AVAP, the Pierce Foundation for Scientific Endeavor, and the Environmental Services Optimization Playbook, ESOP. We also acknowledge generous underwriting from Cintas Corporation, which made this program possible. As a reminder, this symposium will be available on demand for 90 days in case you miss any portion of the program. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. Thank you for your participation, and please stay tuned for more symposia to come this year.
We'd like to welcome you to the first session, Environmental Hygiene-Related Imperatives for Value Analysis and Infection Prevention. It's a treat to have four presenters for this section: Dr. Paul Pierce, John Scherberger, and Robert Tussey. We're going to show you value analysis mapping isn't just for the clinical team, but also for purchase services, and we're going to do a deep dive on environmental services today. Dr. Paul Pierce is going to take us through the section on knowing thy enemy, really what pathogens are out there in the microbial jungle, and it's going to give us an overview on how environmental services impacts clinical outcomes. And then we're going to give our attention to John Scherberger, who's going to help us to appreciate what infection prevention textiles are and an underreported CMS reimbursement, your finance teams to get CMS reimbursement related to infection prevention textiles, what falls into that category, what worksheets are there, and an article that was published. And then we're going to take those concepts and what we saw through the lens of value-based purchasing or mapping for EVS, and then we're going to see how it was applied in the real world to the largest health system in the country, a Common Spirit. And Rob Tussey is going to help us to appreciate what him and his affinity or multidisciplinary team did. And then where do we go from here? Where do we find additional tools and resources that we can walk away from this presentation with? And then, of course, you'll have the opportunity to have a Q&A session through the chat bar with all of the presenters after this. We'll go through introductions as we begin each section. Denmean said it best: we have learned to live in a world of mistakes and defective products as if they were necessary to life. It is time to adopt a new philosophy in America. Best efforts are essential. Unfortunately, best efforts, people charging this way and that way without guidance of principles, can do a lot of damage. And so that's the most beautiful thing about value analysis mapping. The principles that are applied help us to guide ourselves into making the right decisions for the patient, for the healthcare workers, and for the finance being fiduciarily responsible. So what is a value analysis professional? Specifically responsible for bringing all of the multidisciplinary team together and making sure that purchased services also can apply those same principles. So now let's talk a little bit about when we had our conference back in Scottsdale through AVAP. We talked about organizations that were at the advanced portion of the curve or the maturity curve for value analysis professionals. And we had heard from Alex Warman from Lehigh Valley Health Network, and they had a pretty robust governance structure when it came to value analysis committees and teams. And he made the comment, and this was backed up by Joey Dixon, who I have permission to share his stories, that 50% of the spend outside of the med-surg area falls under purchase services. So when we're looking at impacting clinical outcomes as well as cost effectiveness for our healthcare facilities, that we don't want to forget about purchase services. And we talk about the value analysis maturity curve, and we can see organizations that have no process versus organizations that have grown into a mature value analysis process, consistency and focus on safety, quality, total cost of care, clinically driven outcomes, evidence-based evaluation for products, services, standardization, reduced waste, quality. And so really, when we look at the report that was published in 2021, State of Hospital Value Analysis, we can see that this also held out purchase services as an opportunity. So let's just look for a moment at this image together. And we can see these are all areas where purchase services are in our facilities. Environmental services and facilities, of course, parking, whether it's valet or garage, security, the greeters, patient transport, pest control, HVAC, food service or dietary. Now let's peer through one of those windows into the patient room. And now we can see television services, privacy curtains, laundry and linen, bed and stretcher repair, medical gas, and of course, waste. All of these areas fall under purchase services. So when we say what are purchase services, really anything that's on this slide: clinical services, ancillary services, support services, repair and maintenance, or even facility services. And the challenge with the history of purchase services, historical challenges, is data. Where do you find your contracts? What's your spend data, your usage detail? How do we find out the breakdown of these services? How do you know if you're getting the best value? What gaps exist? What are the potential opportunities? And how do we track our progress? And then, of course, how do we evaluate if they're effective? The services that we're purchasing in these areas, what is the evidence-based data? What type of practice guidance exists from the authorities having jurisdiction, or regulatory guidance, knowing that there's over 629 regulatory agencies that impact healthcare organizations? So now let's look specifically into support services under the purchase services category and talk about some of the challenges and large impact that environmental services has on our healthcare facilities. So they're dealing with safety and health, both for the patient as well as the healthcare worker. They're challenged with room turnaround times or patient throughput or progression. Staffing challenges, you're going to see a lot of focus on workforce development, engagement, recognition, and retention of our healthcare staff. Facilities priorities, constraints for the budget, and of course the new definition for AORN or AORN, however you want to say it, for environmental cleaning, cleaning, disinfection, and then monitoring for quality. And then, of course, proper and consistent training. So let's cover our first learning objective. Understand what is the definition of value in a mature value analysis map, maturity curve, and when we make best value purchasing decisions that impact quality, care, and cost. Well, it can be defined: value is the equation of quality, whether it's safety, services, and outcomes, divided by cost. Not price, but cost. So that's factoring in everything involved. Now, when you look at ARM, which is a personal membership group for supply chain executives underneath the American Hospital Association, but we see up in the upper right-hand corner of the slide that the patient is at the center of it all. So how does it impact the patient? What is the outcome for the patient? Is it the highest quality and the cost? So it's not looking at these independently of each other, but rather the correlation or the intersection of quality, cost, and outcomes. And of course, decisions being based on all relevant information, not just price. So what happens when decisions are made in purchase services without using value analysis mapping? Well, we see failures. Just to give some specific examples. So if disposables are chosen over reusable products, it could have a higher consumption rate, less efficacy, or impact on the environment or the waste stream. If a cheaper, thinner mill for a can liner is chosen, the bag could break, or staff could use 2 bags to compensate for that, which would drive up cost. Or, and again, I have permission from Joey Dixon to share this story. And that's they chose a valet provider, and the valet, they started having complaints from the patients. The people weren't showing up to work. Well, they chose a lowest cost valet provider, but they didn't factor in the fact that they were not paying their folks, their staff, a reasonable wage, so no one was coming to work. See, these are opportunities for failure if value analysis mapping is not implemented for purchase services. And of course, we won't cover every single one of these, but there's a lot that's involved when doing a cost benefit analysis for environmental services under the purchase services category. Of course, having a documented process, and you can look at this cartoon later, but what happens if you don't follow that documented process? Now, where's a good place to start in your documented process? Well, CMS and performance improvements, conditions of participation. There's typically an opportunity for improvement report, an OFI report. It's sent by the lead clinical data specialist to this group of folks on the Affinity team. And by learning what's on your facility's OFI report, will directly connect your value propositions to what's important to your healthcare facility. Also, too, working with your infection preventionist and pulling the antibiogram, or in a simpler way, the bugs and drugs report. What pathogens or bugs are we fighting, and what drugs are we prescribing? And so understanding what's on that will help you understand what multi-drug resistant organisms you're battling within your facility. And then, of course, following good literature analysis or research review, taking evidence-based outcomes and strength of evidence. And of course, going to peer-reviewed journals and publications like AGIC for the US and CGIC for Canada. Also, too, using tools like this provided by the CDC. HICPAC developed this tool for assessing products for infection prevention and EVS. Really, whether it's clinical or non-clinical, this tool can be used to assess a new product, to compare two products, or to serve as a workflow when guidelines are being considered for recommendations for a product. Other tools that you'll find on AVAP's website. As members of AVAP, you can download value analysis grids for decision-making criteria and evaluating and rating tools for new products or equipment or services, and how to impact making good decisions by evaluating all information. Then we turn our attention to courses like the Value-Based Purchasing, Evaluation, and Implementation, or VPEI program, which is the value-based mapping or value analysis for EVS and materials management. We start seeing programs that really help to elevate the level of expertise and education within our director positions within the healthcare facilities. So we start seeing robust cost-benefit analysis. This is just one example of evaluating disinfectants that environmental services uses to identify the disinfectant type, the characteristics, that it has the kill claim for the most prevalent healthcare pathogens, that it has the fastest kill time or wet contact time, safety, ease of use, and of course, other factors like manufacturer support and overall cost. And a really good cost-benefit analysis that fleshes out all of the benefits, clinical outcomes, and impact on the workforce. And of course, we see facilities that are dashboarding or tracking all of these key characteristics, including value-based purchasing. We see EVS teams that are on the advanced side of the value analysis, a maturity curve, tracking value-based purchasing. And of course, understanding that we have human factors engineering, or we have humans that implement processes and products and services, and addressing change management using robust tools like the Prosky methodology. So all of this really rolls up into what the CDC published in 2019 on how to reduce risk from surfaces specific to environmental services as fomites, and really following the 6 key foundational pillars of integrating environmental services into the hospital's safety culture, making sure that they are considered for the important role that they have and having a seat at the table, that the staff is highly valued, educated, and trained, that they're using appropriate cleaning and disinfection technologies and products, and standardizing those based upon the setting specific for that clinical outcome, and monitoring the effectiveness, the adherence to these cleaning and disinfection protocols, and then providing necessary feedback. And of course, there's plenty of guidelines and toolkits that are out there. The ESOP, Environmental Services Optimization Playbook, is really bringing all these authorities having jurisdiction into one resource guide that's found through the Pierce Foundation. Now we're going to give our attention, speaking of the Pierce Foundation, to Dr. Paul Pierce, who will introduce himself and talk a little bit more about the microbial jungle.
Thank you, Aaron. I appreciate the opportunity to make this presentation related to healthcare value analysis and infection prevention. My part of the program is really based on my experience in the clinical laboratory and in the environmental testing laboratory. And my specific interest is in the microorganisms and the pathophysiology of those organisms, and the impact that they have on the value of the healthcare setting. So when we look at the microbial jungle, I like to think of it in terms of the principles, the microbiological principles that we're all confronted with day in and day out, and help you develop a guide, a leader's guide to understanding the methods, means, and equipment that are available to control microbial contaminants and take care of the environment. One thing that I have found over the years, and I've been doing laboratory testing for a lot of years, and one thing that I have found, though, is the best leaders and the best people are the people who best accomplish their goals and their purpose. They have to develop a certain mentality. And that mentality is based on a mental map of information, resources, opportunities, experiences, and values. And then that good leader, that best leader, will check that map constantly. And we look at this, if you see that little diagram graphic there on the right, when you look at all of the things that go into developing that mental map, it's very complex, but they're all principle driven. And if I get one message across or one point across, I hope that you'll understand, or that I can help you understand, that principles drive everything that we're going to talk about today. All the topics, all the anecdotes, all the experiences are principle driven. Develop that mental map on a regular basis. Just continue to add to it, to look at all the opportunities that are available to you to add value to the work that you do. You may have heard this story before, but I've always liked this story. This is a graphic of Dr. John Snow. Dr. Snow was a physician in London in the mid-19th century. And he was taking care of his patients in his neighborhood, in and around his part of town, and began to develop a pattern of severe diarrhea among many of his patients. And he was convinced, after careful study and getting his map board out and his pens out, he was convinced that the water that the public was drinking and using was contaminated with something. In 1855, 1860, there was not much knowledge about the different types of microorganisms. But Dr. Snow felt like that the problem was the drinking water. And so he took his concerns not only to the city council, but to the regulatory authorities that were in existence at that time. And he said, the water's a problem here. We have to do something about it. Well, he met a blind alley too many times. And so one day he said, I've seen too many people get sick and die from drinking this water. It's the only thing that can be the cause of this severe diarrhea. And I can't get any help to shut down the water supply into this neighborhood. So I went back into his house and he got his toolkit and got a screwdriver and a pair of pliers. And he proceeded to go down to the Broad Street pump and take the handle off the pump. As soon as that handle was removed from the pump, within a week, there were no new reported cases of this severe diarrhea, which turned out to be cholera. And we've heard that story before, but cholera is a very severe disease and leads to dehydration and death if it's not treated quickly. So Dr. Snow took that handle off the pump, did a common sense, principle-driven process to eliminate the cause of, or the source of, the contaminant. And then over time, it was discovered that yes, indeed, in fact, that cholera was the cause of organisms. When he took the handle off the pump, very simple, very principled. If you have a problem, then you go to the root cause and you eliminate that root cause. So that's what Dr. Snow did. New cases of cholera virtually disappeared. His patients began to get well quickly. The thing about all of the other points and all of the other processes that we're going to be talking about deal with microorganisms. And that's my background, that's my experience, that's all of my training and education and work experience relate to bacteria, yeast, fungi, viruses. And what I'd like to do is encourage you to learn, add to your mental map what you're really trying to prevent. What are you trying to clean up or trying to prevent when you make your selections of products or when you make your selections of methods, means, and equipment for your facility? What do you do? And this is a graphic here, just shows you that HAIs, healthcare associated infections, generally are caused by one of these 5 organisms or a combination of these 5. Gram-negative bacteria, for example, E. coli, Pseudomonas, Serratia, Acinetobacter. Gram-positive bacteria, MRSA, vancomycin-resistant Enterococci, Candida, whether it's Candida albicans or Candida auris, that's the yeast, molds, Aspergillus, other dermatophytes, and then spores. We're very familiar with the types of spores that we run into in a healthcare setting, that being Clostridioides difficile. So all of these organisms, though, are manageable, they're controllable if we keep in our mental map the fact that they're there. And regardless of what you do, those organisms are always going to be there. Our challenge is to reduce their number and reduce the possibility that our patients are not exposed to those microorganisms. They have to break the chain of infection. When you look at the place that these organisms come from, I won't go through all of this, but in these microbial reservoirs in a healthcare setting, the wounds, the percutaneous devices, biofilms, natural oral flora, bloodborne pathogens, people who develop sepsis, sinks and faucets, non-tuberculosis mycobacterium, non-TB mycobacterium, Legionella, Serratia, Pseudomonas, the dry surface, those contaminants that exist on dry surfaces, Acinetobacter, Clostridioides. And then in construction, if you're doing any construction, as you're planning on your value analysis, what kind of products am I going to use? You have to consider the fact that all of those products are contaminated with some type of microorganism. I don't know if it's Aspergillus or whether it's another type of fungi. It is, they are contaminated. Everything that you bring in the construction mode is contaminated with microorganisms. There's not much you can do to sanitize, or you can't sterilize construction materials, but you can be very cautious about how they're used, what the source is, and consider those things that might contribute to healthcare associated infection. Just another graphic here to give you some perspective. Clostridioides or Clostridium botulinum, Clostridium tetani. These are gram-positive rods, gram-positive bacilli. We have E. coli, Salmonella typhi, Helicobacter, Strep pyogenes, Staph aureus, Vibrio, cholera. All of these organisms can cause healthcare-associated infections. The principle here, though, that the point that I want to drive home is that although microbiology can be a very complex topic, and it's important that you know the principles, just remember that microorganisms are living organisms, and they have as much drive to stay alive as we do. And so they are going to develop processes to ensure their survival. We've heard of MRSA, MRSA, methicillin-resistant Staphylococcus aureus. Well, when I first got in the microbiology business, MRSA was not even on the map. We didn't even know about it back in the early 70s. So what we did find out that Staphylococcus aureus of that day developed these plasmids, these little loops of genetic material that allowed them to create a resistance to penicillin, to the ampicillin, penicillin type of antibiotics. So you can see the complexity of the bacterial cell anatomy, and just keep in mind that microorganism is going to fight you. It's going to try to survive as best it possibly can. We can't expect them to just disappear with a wing and a prayer, because they're in this for their well-being. So the microorganisms are. Viruses are the same way. You know, we've been dealing with coronavirus now for several years, and this is just a graphic of the coronavirus. And then on the surface, when you're looking at cleaning the surfaces, you have to remember that surface, even though it looks clean, it may not be clean. I wanted to put this slide up as a representation. We read a lot about biofilms and read a lot about surfaces. The biofilm is an accumulation of bacteria, proteinaceous material, cleaning agents of water, and this biofilm over time builds up. So we have to be very diligent in how we clean before we disinfect. So the cleaning helps remove this biofilm. This slide on the right is a piece of stainless steel, typically used in hospital setting, but you can see the striations, and those striations, those little grooves in there, allow for the accumulation of biofilm, for the accumulation of microorganisms in those grooves. So when you're planning your methods and your means and your equipment for cleaning that surface, you have to be aware that those microorganisms are hiding out in all those striations, and you can't just get it with one wipe. This slide maybe will help you understand some of the anatomy, some of the physiology of the microorganism and their flagellation, the way that they are modal. These different types of flagella not only allow the organism to be modal or to move, but it also allows them to attach more readily to those environmental surfaces. So they get the microorganism and their flagella get wrapped up in that surface, and it makes it more difficult, makes them more difficult to remove. And then on the detergents and disinfectants, when you look at value analysis, detergents are different than disinfectants. Detergents are designed to clean surfaces, are designed to clean, and disinfectants are designed to kill organisms that are on the surface after the surface has been cleaned. So as you look at your value analysis, you have to consider the cleaning and the disinfection. So thank you again. This is my information, always available. If you have any questions, feel free to give us a call at the Pierce Foundation. And of course, the QR code there on the right, take a picture of that, and you can look us up on the web. I will turn it over to Mr. John Scherberger.
Hello, I'm John Scherberger. I'm with the Pierce Foundation for Scientific Endeavor and the ESOP program. Today, I'll be talking about a number of things that are essential to the environment of care. And we're going to be looking at the environmental care through the eyes of value analysis. The things that you are going to learn today, your knowledge base is going to be increased. We're going to be looking at the great potential for CMS reimbursement that is so often overlooked by hospitals and by value analysis committees. We'll be looking at infection prevention textiles. What are they? Are they defined? Is there a definitive limit to what is considered an infection prevention textile? We'll be looking at cubicle curtains and why a service contract provides a sustainable process in which we can ensure that every step possible is being taken to avoid the contamination of patients and staff through contact with contaminated curtains. We'll be looking at the on-site generation of what I consider, and so many other scientists have considered, the safest disinfectant and cleaner. We'll look at commercial laundering versus on-site and home laundering. Bring this all together as part of the environmental impact on our world, on our community, and on our families and friends. The Medicare reimbursement manual, Medicare provider reimbursement manual, is so voluminous that I've gone through and I brought in two portions, two chapters. Part one is chapter 21 in a Medicare provider reimbursement manual. It's entitled Costs Related to Patient Care. And also in part one is chapter 22, Determination of Costs of Services to Beneficiaries. I am not going to go and read all those. It would be absolutely boring for you to sit here and listen to me read. But I do want to point out a couple of things. These two chapters provide the general policy of Medicare cost reimbursement for a number of different healthcare providers, such as skilled nursing facilities. We are providing the billing form and the references, the sections, and the worksheets for you. So if you are associated with a skilled nursing facility or a hospice, hotel, hospital, rural health clinic, renal dialysis facility, and home health agency, they all are addressed in the CMS reimbursement manual. I would also like to point out that a number of years ago, there was an article, Infection Control Today, the case for moving infection prevention textiles to the linen and laundry department. For years, Environmental Services has been purchasing their, what they call, or have been called in the past, their rags and their mops. And in fact, they were rags because they would use discarded towels and washcloths to try to do a good job of cleaning the environment. With the advent of microfiber and ultra microfiber, we have needed to look at moving it from an expense in the Environmental Services Department, moving it to the Laundry and Linen Department. This article gives you information. It provides all the information that you see regarding those operations up top. We've also given you the website. Some people in your accounting will say, well, we've never done it before. Well, that's one good reason to try to do it now. We'll also look at infection prevention textiles. What are they? As I said, CMS does not have a definitive list. A lot of people would think, well, they're towels, washcloths, sheets, beds, bed linens, but they also include every textile that is used in a healthcare facility, such as the healthcare personnel attire, the white coats, the scrubs, the uniforms, and uniforms that are worn by the Environmental Services Department, the Facilities Department, and other people having contact with patients, other hospital staff, and providing services throughout the hospital. It also includes isolation gowns, and we had a big problem during COVID with isolation gowns being of short supply due to the inability to get them from overseas. Isolation textile, infection prevention textiles and isolation textiles also include privacy curtains. But that's one of the reasons why we should be looking at a privacy curtain program. And also the healthcare grade ultra microfiber, H-gum, the wipers, and the mops. Now, I do want to say one thing about infection prevention textiles regarding H-gum, the textiles that are used by environmental services. Years ago, we were using cotton mops, and cotton mops have been in process for well over 150 years, accepted in hospitals. But they should have gone the way of the Goonie bird. We now had introduced into the United States back in the late 90s, a microfiber, which is a product, it's a bicomponent product made bicomponent being it's made up of two different materials, polyester and nylon. This is spun. The filaments are extruded out of spinnerets in a factory, and then they are separated. Different ways of separation. I'm not going to get into that, but they're split to 16 times. So one tiny filament is split 16 times. This means that the filaments are less than or equal to 0.3 microns in size. That is tiny. They are bleach tolerant. Bleach tolerant means it will not break up immediately. One of the key things that has to be done with these textiles is they have to be capable of being washed and dried at greater than or equal to 160 degrees Fahrenheit. Now, why is that? Because any bacteria, virus, spores, fungi that is on the wipers and on the mops that goes to the laundry, they are the final process is a heat disinfection. One of the keys that we have to look at that when we're looking at HVAP and quality purchasing is don't look at the price, because too often the lower the price, you're looking at sponges and cellulosic material that is inside the mops. There's one manufacturer, very well-known manufacturer, that they manufacture their mops to last 14 times, 14 laundry cycles. That's a waste of money. And that means they start breaking down while they are in use. Now, cubicle curtains, we have to look at these. They are touched so often. Oftentimes people say, well, then I'm not contaminating them because I'm wearing a glove. Well, if they're wearing gloves and they've touched the patient environment, and then they touch the cubicle curtain, the curtains are contaminated. So oftentimes when you have a cubicle curtain service, they set up with the client how often the cubicle curtains should be replaced. You're guaranteed that they will be replaced and laundered and returned. They also provide the installation and the removal of the curtain. So that's going to avoid one of the biggest problems that environmental services has, that people don't have to get up on a ladder. Now, are they sustainable? Yes, they are. Curtain products, programs and products are sustainable. I also want to talk about commercial laundering versus on-site laundering, on-site being on your premises, or laundering at home, to require the wearing of uniforms, scrubs, white coats, confined only to the property. We all have seen doctors and nurses and technicians going out to their local eatery for lunch, or going to the grocery store, and they are still wearing their uniforms. We don't know where those uniforms have been or exposed to. So in Great Britain, because it is a national health service, they made a regulation, they made a law that no one can leave the facility wearing their scrubs or their uniforms. When they come to work at the hospital or the healthcare facility, they change clothes. Before they leave, they change clothes. All healthcare surfaces are potential fomites. So when a person leans up against a bed or sheets, or they come in contact in passing with another person, the fomites can move. They don't jump up, but they are moved by the brushing of different fabrics. And fomites can live on fabrics for up to 3 days. When someone goes home with their uniforms, they are endangering their families and the community, because they're exposing them to contaminated uniforms. Now, some people say, well, let's look at it's more convenient for us to have disposable isolation gowns. It's more convenient for us to have disposable wipers, disposable mops, as opposed to reusable. But the slide right here shows very clearly that when we're looking at the average size hospital in the United States is around 200 to 300 beds. So if you're looking at a healthcare grade ultra microfiber, the cost goes from anywhere from $165,000 a year to $195,000 a year. But if we look at the disposables, those prices go from $473,000 to $591,000. Unfortunately, too often the opinion, and everybody's got an opinion, the opinion of nurses and technicians when they say, well, it's easier for us, and environmental services does this as well, it's easier for us to use disposables as opposed to reusables. Well, when you're looking at $195,000 for reusable as an expense to a hospital, compared to $591,000 as an expense, that's a lot of money. keep in mind what I talked about earlier, reimbursables. When it's a contract, a full service contract, and it's not an expense like the disposables, $591,000, that's out the window. But with $195,000, there is a great potential for reimbursement from CMS for a portion of that. So keep this chart in mind. I know that I've gone through this very quickly, but I could talk all day and provide facts and figures, but I'd probably be worrying you. You can contact the Pierce Foundation and ESOP, and we'll be delighted to give you more information that will help you help save lives. Thank you very much.
Hello, my name is Rob Tussey. I work with Common Spirit Health. I serve both as a market director of environmental services for the Houston market, serving our academic affiliate, Baylor College of Medicine, working at Baylor St. Luke's. In addition to that, I also serve our national company, Common Spirit Health, and work in training, leadership development, as well as value analysis, selection, and providing information as it relates to regulatory compliance in the environmental services field. We started now about a decade or more as we have developed what is now our Common Spirit National Program. This started out in a small hospital system in Lexington, Kentucky, and then our idea was that we would be able to do this as an in-house program and be able to teach our employees while they were able to maintain that level of integration with the facility, as they would be facility employees and work directly for the individual MBOs and hospitals across the nation. And, they would have a greater buy-in. We also knew that we would be able to take all the most recent data and all the most recent information as it relates to industry-leading best practices and be able to merge those together into one program that would be franchisable across the nation, that we would be able to replicate it in hospitals all the way from the East Coast to the West Coast, as far north as the Dakotas and as far south as Texas. And we would be able to take these same principles and guidelines and do that. This started us on a very long journey and finding appropriate partners that would be able to share in our passion for what we do, our passion for helping save lives, and our passion for the science in environmental cleaning in the healthcare environment would definitely be foundational principles of what we would want to build this program on. And then, of course, the multidisciplinary subject matter experts providing support for our rollout, once again, was a key component of being able to do this, being able to confer with the best of the best within our system, as well as those representing other organizations, deeming authorities, and authorities having jurisdictions across the nation. I'm going to talk a little bit about our EVS program. One of the largest companies globally in the world right now is Disney. But as Walt Disney would many times be quoted as saying when people would talk about this worldwide phenomenon that he helped create, he would always say, it all started with a mouse. Well, in environmental services, what we do every day, it all starts with the cart and being able to have the appropriate tools to do the job, to be able to have the outcomes is a key foundational piece for us. One of the principles that we understand that our world is built on a concept of seed, time, and harvest. And while you may think that's simply an agricultural term, you'll also find out that it is a key item in every part of life, whether it would be relationships, whether it would be your professional career, of course, agriculture. But what we do every day is a product of seed, time, and harvest. Having, the harvest representing those desired outcomes, things like having world-class best turn times for discharge times and terminal cleaning, being able to have an environment where those pathogens that thrive in environmental surfaces, we want to have an environment where those have been removed from our environment. So being able to have those outcomes, you can't have that without the seed and the time. The seed representing things like training and things like having the appropriate tools to be able to do the job. Time, of course, representing investing in your frontline staff, doing the training, making sure they understand each and every tool, making sure they understand each and every chemical. So, and being able to have the true science in the cart. At Common Spirit Health, we needed to determine the best possible manufacturers to be able to achieve the outcomes that we wanted to have. This came with our chemicals, being able to have the smallest amount of SKUs or products available in our line. Once we found world-class items that we could replicate across the nation and have the exact same outcomes, those were the partners that we wanted to have. We didn't want to be doing one thing in Kentucky, completely different thing in California. We wanted to be able to franchise what we did everywhere across the nation. So if an environmental services leader, whether it would be divisional director, whether it would be our system vice president of environmental services, if he walked in a hospital in one state and walked into a hospital completely across the nation, that he would see the exact same process, the exact same products, and the exact same outcomes that would be derived from being able to follow the processes that we had set in place. Our key performance indicators, having this dashboard as what we do, of course, it's like a dashboard in a car. If one of our key performance indicators is out of alignment with what our desired outcome would be, we understand that that means one of the processes is not being followed. For instance, we're not achieving the desired turnaround time for discharge cleaning. If that is not meeting our key performance indicator for world-class best outcome, then we know that something is not being followed correctly. Most likely, we could go all the way back to that cart. As I said before, it all starts with the cart. When one of our key performance indicators is not where it should be, the first thing that we look at is, do we have the cart set up properly? Do we have the proper products? Do we have the appropriate disinfectants? Are we using the correct cleaning substrates? As we said before, as simple as making sure that we are using our healthcare grade ultrafine microfiber instead of disposable wipes when we're doing a terminal clean. We understood that we were able to remove much more dust and debris, being able to meet regulatory recommendations like the AORN. When they talk about clean, their definition of clean is removing dust and debris from the environment. And we know that if we're not removing the dust and we're not removing the debris, then we're not removing the pathogens either. As you see here, our key performance indicator guidelines, we want to make sure they meet certain pillars such as financial stewardship, quality, safety, efficiency, being able to have employee empowerment. Of course, we understand that if our employee engagement scores are high, then the work engagement is going to be high. We're going to see everything across the board do better. If our patients are happy with that, of course, we know that their perception is the reality that we live in. So we want to be able to do that. And we're living in a day and a time, as you heard from Dr. Pierce, as there are lots of new pathogens on the horizon. And, we are living through over the last few years in a global pandemic. And we know that there are other pathogens on the horizon, and we need to be ready for that in environmental services and have a multidisciplinary group that's able to help navigate through those waters. But as you see these pillars here, value-based analysis has a strong presence in everything that we do. Our pillars are that of financial stewardship, because we need to be good stewards of our resources and be able to harvest those world-class results that we so eagerly desire. Having a standard work cleaning process helps us follow, once again, authorities having jurisdiction and giving recommendations like AORN, like CMS, and others. Having that standard cleaning process of cleaning top to bottom, of being able to clean from cleanest to dirtiest surface, and being able to do that in a clockwise or counterclockwise manner. The pathway that we follow in the environment to be cleaned, this is something that at Common Spirit Health, we brought in more people from that. We worked together with a group of Lean Six Sigma black belts from Purdue University to be able to create some absolute world-class standards in how we do things, and being able to leverage world-class experts like many of the ones that you have seen and heard from here today, like Aaron Jett and John Scherberger and Paul Pierce, and having them to be able to partner with us on this journey has been absolutely imperative. Developing a manager's operations playbook. This was, as we wanted to franchise our process, we wanted to be able to create something that was tangible, something that would give our managers across the nation at their fingertips everything that they needed to be able to implement and maintain the program, to be able to be financially responsible, and also to be able to show their key performance indicators during that process. But having that was also a huge part of being able to do that, and explains everything to one of our leaders, from the patient experience to how to perform and staff a facility, has training and education, and also things like our KPIs and service level agreements. Using science-based cleaning, this was what had to happen in a facility and group like Common Spirit Health. Having in excess of 140 hospitals, the expectations are very high. We have on staff just absolute celebrities in the world of infection control and prevention, like our system vice president, Roy Bukijian. One of the things that he needed to happen in order for him to be successful, environmental services has to be successful. Roy was most recently in a presentation with the AHE quoted as saying, infection prevention and control and environmental services are one and the same. And such a bold statement, and a very true statement, because our success truly is his success. But one of the things that he wanted as a partner in environmental services is he wanted to make sure that we were doing the science behind cleaning. And this was one of the times when having an education and value-based purchasing, analysis, and implementation was a key component in my education, and a foundational principle for me to be able to employ with this. But being able to reach out to other people like Dr. Paul Pierce, who was able to help us establish scientifically the efficacy of the products that we were using, being able to reach out to people like John Scherberger to help out with the selection of the cleaning substrates that we are using. And a lot of these people are very humble when they implement or when they talk about themselves. But these are just true giants in what we do, and just come with a wealth of knowledge and experience, and are more than willing to share this because they care just as much about saving lives as we do. Having a education in best practices and knowing how to implement things, and being able to know what our partners on the clinical and scientific side need from us, it is a key component in being able to have a seat at the table when it comes to decision making, when it comes to purchasing new products, when it comes to the different surfaces that are being introduced into your facility. And AHE has wonderful certification programs developed that help teach this. They bring in people with strong educational background in these different avenues, and are able to share it in such a way that it makes sense to environmental services leaders. So AHE and being able to partner with them was also a foundational and key component of being able to do that. And then us taking that information and sharing it in all of our facilities across the nation. So as we were growing our program in its infancy, as we merged from Catholic Health Initiatives and Dignity Health, as we merged those two together into Common Spirit Health, about that time, I was able to take what I consider to be probably the best offering that AHE provides, being the Strategic Leadership Series known as Value-Based Product Evaluation and Implementation. And in this particular program, I was able to learn how to properly read white papers, how to take a look at the different products and how to set up true scientific evaluation on the products that I would need to be able to make my program successful. And not only that, but it gave me the building blocks for how to implement the programs that we were building and how to make those be successful, how to franchise them, how to roll them out, and just truly brought together EVS leaders from across the nation, different backgrounds, and give us just the ability to be able to speak to the other disciplines that are around the table and be able to understand what it is that administration needs to know when I want to purchase a new piece of equipment, to be able to put together a storyboard, to be able to show them this is where this would save our hospital money. This is where this would improve our infection rates. This is where this would help me to be able to turn a room over quickly if we had this type of furniture. So being able to just truly to create and help the different individuals around the table when it comes to the decision-making process in the healthcare environment, basically to be able to speak their language. So this is definitely one of the programs that, that I can't stress enough, that is imperative for you if you're wanting to build an in-house model. Or if you're part of an outsource and you want to be able to better speak to, everyone from administration to nursing to physicians to infection control and prevention, this is a key class that would be able to give you just some of those foundational building blocks to be able to start those conversations. As we go on moving forward with science-based cleaning, that as science progresses, as the diseases and the pathogens change, we have to change with it to meet the ever-growing demand, and making sure that our disinfectants are appropriate. And we always follow the model that Spalding created as far as the classifications for that, and making sure that we have the correct low-level disinfectants. Of course, we don't want to go in and damage our surfaces, damage our equipment, damage the furniture that would be in the room. We want to make sure that we are using an appropriate disinfectant that meets the desired outcomes. And then once we have that, we can go to intermediate level when we have something that we would need to be able to remove. And of course, being able to know and understand the science behind that. I think every one of us got a crash course in the CDC and in the EPA over the last couple of years. But being able to have programs that help us to grow with that, to grow as our demand grows and as our profession grows, science-based cleaning is always an important factor in that. Having the appropriate tools and equipment, being able to properly evaluate that has always been a foundational piece. Authorities having jurisdiction like CMS, one of the things that I've learned in my encounters with CMS over the years is the emphasis that they put on personal protective equipment, having the same methods to don and doff personal protective equipment. So having the same type across the nation is always important, and just in our experiences in Common Spirit Health during the pandemic, if it weren't for reusable PPE and personal protective equipment, we would have been in some pretty hot water as the pandemic grew and as supply chain challenges came into perspective. But being able to have that and have partners who could help put that in our hands, even in the face of a pandemic, was very important. So one thing I would tell you, as you choose your manufacturing and vendor partners, make sure that they have contingency plans in place. Ask the questions. What would happen if supply chain shut down? What would happen if plant had to close? What is your backup plan? What is your contingency plan? And I can tell you the vendors that we chose at Common Spirit Health, aside from the fluctuation and the demands upon us in-house, as far as our vendor partners go, you would have never known that we were even in a pandemic. We always had our microfiber. We always had our personal protective equipment. We always had the chemicals and the tools that we needed to be able to do our jobs day in and day out. We wanted to have, of course, healthcare grade ultrafine microfiber that could stand up to the CDC laundering guidelines, because we would not want to bring something in that is reusable, knowing that it has come in contact with a pathogen. We know that we needed to have outsourced laundering because we weren't able to create and maintain the appropriate CDC laundering guidelines. So finding a vendor that is able to do this and able to validate that for us, and making sure that they have a system of checks and balances, that they're not just saying that they're going to provide something and don't actually, because things like microfiber, if it's not laundered appropriately, it can potentially bring things in. But we have a vendor partner that is properly accredited in their own discipline, being able to have a substrate that will even hold up to that, because we know that it has to be able to be laundered many times over, but we still want it to maintain its integrity when we're able to do that. Having mops and dust mops that have the appropriate Velcro backing, because if you put it on the bottom of your pad holder and it just rolls up on the floor and I have to use 4 or 5 of them to be able to do that, it's just not appropriate. The first thing that I do when a potential microfiber vendor comes in with me, the first thing I do is ask for one of their mops, and I cut it in half with a pair of scissors. I want to see what's in there, because I know, not only do I need to trap, capture, and remove pathogens, but I also need to be able to release the disinfecting properties of the chemicals that I'm using, because I know if I'm not able to have, for instance, we use quaternary ammonium compound disinfectant. All of us have heard of the concept of quat binding. So if I don't have the appropriate healthcare grade ultrafine microfiber that's made with the appropriate materials, some of the agents that is used in certain types of microfiber will actually hold in those quaternary ammonium compounds and not release them to the surface where I need them to be released on. Essentially, I could potentially only be cleaning in water if I don't choose the correct manufacturer, and being able to understand the science behind how those things are created is imperative for me to be able to ensure that I am helping save lives and not doing harm to my patients. As we were creating and working with Lean Six Sigma black belts and being able to understand the time that it takes for our environmental services technicians to clean something as simple as a patient room, we wanted to teach that true start at the door, end at the door, clockwise, counterclockwise, developing this and having a method to our cleaning, a systematic approach to cleaning. We were able to reduce the steps taken from 825 to 326. That's over half, a 61% reduction. The distance traveled, 1375 versus 543. So what does that mean to me as an environmental services leader? That means we save time. We're able to turn a room over in world-class time and be able to do it consistency. I have a better aptitude to be able to teach a process that takes half the time as a process that would take double the time. What does it mean to an environmental services technician? At the end of the day, I haven't worked myself to a point where when I go home that I can't tend to my family. When I go home, I can't play with my grandkids. When I go home, the only thing I am able to do is just sit down in a chair and just try to relax from having expressed all this energy and taken my body to its limits. That I can walk out at the end of the day with my head held high, with my back straight, and be able to go and enjoy the people that I'm there to help provide for in the first place. A service level agreement, probably one of the most key components to a healthy and strong environmental services program. To do those on a national level, but they're also tailored to some of our individual MBOs and specialized service offerings. But it is an opportunity for us to meet with the leaders and those who provide life-saving care in the clinical and healthcare environments, but it helps them to understand this is exactly what environmental services will do. This is what we will clean. And we go through each and every item that would be in their areas. So if there's a piece of equipment that we don't clean, they understand that we don't clean it, and that they are responsible to either clean it themselves or have a conversation with the appropriate party or group or department that would be responsible for that. They also know how often to expect us. What hours will we serve in their department? And if they need us after hours, how will they contact us? They understand depending on what pathogen they have. So for instance, if it's an ICU and they have certain types of isolation patients or isolation patients throughout our general population, they understand what we will be using, how long it takes for us to kill that particular pathogen of interest, and how we will protect ourselves and help them stay protected by providing things like hand hygiene, personal protective equipment, and all the different services that we provide. All of this is in a conversation and similar to a contract that each of us sign, and everyone is provided a part of this, and we communicate that all the way up to the C-suite and all the way to the frontline staff and clinical partners that we work with each and every day. And once again, that multidisciplinary team, we cannot get what we need to do done without having a multidisciplinary team. We need to have people from the C-suite on board and understanding of what we need and the value that what we do brings to our facility. We need to be able to have the scientific partnerships on our side to make sure that what we are doing truly is helping to save lives. We need to have the caregivers on our team because we need them to know what we are doing to help support them, and as well as being able to help them navigate through the environment so that they can focus on giving that life-saving care to our patients, and that they have a confidence that we are doing everything that needs to be done to keep the environment safe for them and safe for the patients that they are directly caring for. Having a cleaning validation method is imperative in this day and time. As a matter of fact, AORN recently came out with a new definition, which is environmental cleaning. And having a method of validation is something that is necessary to be able to meet that recommendation, something that we've done at Common Spirit Health ever since we very first implemented our program. This is another item that was an award-winning method and approach for us early on when we were in the Central Kentucky region. But having that 3-tier cleaning validation is very important. Being able to do the visual inspections and direct observations, basically the old-fashioned white glove test, and having a checklist of the items that need to be checked and touched to make sure that there's no low-level dust, which is also a regulatory compliance standard. Being able to have things such as a fluorescent marker. We know that as fluorescent marker fluid or gel or lotion that's applied to a surface, this is to help us to teach mechanical agitation to make sure that the cleaning substrates that we are using is effective, because if we're able to remove this marker fluid, then we know that we're also providing the appropriate elbow grease, if you will, or agitation to be able to remove pathogens from a surface as well. And applying this to different types of surface, whether it would be porous surfaces, whether it would be smooth surfaces, surfaces that we have a thought that they're possibly being missed, and high touch surfaces, and then going back in and checking that with a black light to make sure that it was properly removed is a great teaching technique. And one of the things that we stress at Common Spirit Health is all of these inspections. My expectation is that my leaders understand what a clean room should look like. My expectation is my leaders know how to systematically go in and clean and disinfect a room from top to bottom, from cleanest to dirtiest, and in a clockwise or counterclockwise manner to ensure they don't miss any surfaces along the way. But sometimes our environmental services technicians may need additional coaching, may need additional tweaking. And this validation program that we have built helps foster that conversation and direct that conversation so that if there is tweaking that needs to be done, we're able to do this in a non-punitive manner. And of course, ATP or testing for adenosine triphosphate, or we're able to test for this to make sure that that bioburden on a surface has been reduced to acceptable levels. But I definitely suggest having a good cleaning validation system to be able to show others that you truly are scientifically able to reduce the pathogen and bioload in our environment. What does good look like? As you're implementing different things, if we're going in and cleaning and maybe we are doing it inexpensive, maybe we are doing it fast, but if things like C. diff, which we know C. diff is of all pathogens probably has the most opportunity to be an environmentally transferred pathogen. If things like our C. diff rates are high or our surgical site infection rates are high, we know as environmental services professionals, we may have some work to do in making sure that we are doing it appropriately and making sure that we're using the right chemicals, making sure that we're using the right substrates. But we take great pride in Common Spirit, and this is one of our facilities here that I've worked with the professor of infectious disease at Baylor College of Medicine, Dr. Meyer Almahajer, and we've worked together on these types of things, and we have all but eliminated C. diff from the largest academic affiliated hospital in the nation from that, a true tertiary care center where on every day, 60% of our staff or 60% of our patients are immunocompromised. They are in isolation, and we have all but been able to eliminate this disease from our facility. So as you've seen, providing a clean, safe environment at Common Spirit, as well as in healthcare as a whole, it truly is the way that we help save lives. And hopefully in my portion of this presentation, you've been able to see that we can't do it alone. It takes us being able to be good financial stewards. We were able to learn this through value analysis. And value not just being on money, but value in regards to what we place importance on. Of course, we have to be able to do it financially responsible, but we also take value in being able to know that we are reducing healthcare associated infections, that we are increasing quality. We know that we increase quality because our employees are happy. We know that we increase quality because our patients are happy. We know that we increase quality because we're not doing harm to our patients and seeing the infection rates lower, and being able to have a knowledge, being able to speak the language, being able to create a story that we can share with a CEO or a COO, being able to create a story that we can garner the assistance of infection control and prevention, and being able to bring in all the scientific components of the healthcare environment, being able to speak to our physicians and nurses and bringing them on board as a part of the team, being able to talk to supply chain and saying, this is why I need this product, this is why I need this disinfectant, this is why I need this piece of equipment, because I want to be able to help save lives and be better positioned to help create a clean and safe environment. And I just can't say enough once again about having this knowledge, being aligned with people who are able to do that, and even the people on this call have been alongside us and Common Spirit for years now to help us to develop and push our program forward and to help save lives of thousands across our nation each and every day. This was our journey. What will your journey look like?
To earn your contact hour of nursing continuing education associated with this session, you will need to take and pass the 10-question true-false test with a grade of 90% or better. To get started, click on or copy and paste the URL into your internet browser to be taken to our CE portal. You will be asked to register, and then you will be directed to the test. If you pass, you will be able to view, download, and save your certificate. If you do not pass, you will have a total of 5 attempts to retake the test. You may store and share your grades and certificates for all sessions in the portal and access them by using the unique links provided at the end of each presentation. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. We are now launching into our Q&A session with our presenters. Dr. Pierce, you've been working with microorganisms for several decades now. Are we getting any more insights on these pathogens, especially the ones that are multi-drug resistant organisms? Or is there a pattern that you're starting to see? What's around the corner, and what should we be looking for?
Well, that's a great question, because there is a bit of a pattern that's showing up and has been revealed to us. And I go back to that experience with MRSA back in the late 50s, early 60s. The issue really is that these organisms, whether it's Staphylococcus aureus or Pseudomonas or an E. coli, if they're exposed to disinfectants or antibiotics, they have a mechanism, these organisms have a mechanism to develop resistance against those agents, against the disinfectants and the antibiotics. So it's important for us to always remember that what we think it really works now may work for a while, but we have to be diligent about and consistent about how we address the potential for multi-drug resistance or drug resistant, disinfectant resistant microorganisms. The other thing too is that with much of the new CDC information that's coming out, we are seeing there are more than 1,000 different organisms that are viewed as opportunistic pathogens, and we don't know yet what their ability to evolve, ability to mutate, ability to adapt to the disinfectants and antibiotic. We don't know exactly how or when that's going to happen, but we know it is going to happen. So we have to remain diligent with the basic principles of cleaning, disinfection, monitoring, and staying on top of all the issues related with the microorganisms and related with hospital or healthcare associated infections. So if there's a pattern here, the pattern is that it's going to keep the process of multi-drug resistance is going to continue, and we can never be complacent in our approach to that. And that's the reason it's so important for everyone listening, so important to learn the principles, understand who the enemy is, the microorganisms that are out there, understand who they are and what they are, and be sure that your policies, procedures, your methods, means, and equipment adapt to that possibility of developing resistance or developing the ability to withstand those antibiotics and disinfectants. So kind of a long answer, but it's a real challenge, and it's only going to become more of a problem, I think, or more of an issue as the organisms change, our population ages, more sophisticated procedures are carried out, the more potential for infection exists. So the battle's not over. So we have to maintain our diligence and maintain our commitment to the process that we're engaged in.
Great. Our next question is also for John. Why has the NHS required that there would be no home laundering of healthcare textiles What was their rationale?
The rationale was quite simple. They did research, they did studies, and they found that home laundering machines and the chemicals that are available for residents, as well as the water temperatures, were not available to the healthcare worker, whether it's a professional or a licensed professional or an unlicensed professional. And they also have issues in Great Britain about using bleach and using disinfectants. Most of their disinfection in the laundry cycle is based upon thermal disinfection. That's one of the reasons why they made the decision. They also found out that there are people that were wearing their uniforms from work to work, riding public transportation, and riding back home on the same public transportation in a contaminated uniform or scrubs. And they realize that that is not good for their population, whether it's the general population where they were finding community-acquired infections, or their hospital population, both staff and patients that were coming down with healthcare-associated infections that they were able to trace to the communities.
That's all the time we have today for this Q&A. Quick reminder that we will have an extended version of this Q&A with our presenters available in the Pierce Foundation for Scientific Endeavor by clicking on the sponsor section on this event platform. And if you would like to hear Rob's entire journey, that will be available there as well.